Over the past few decades, the use of ayahuasca, psilocybin, peyote, and other psychoactive plant medicines has become much more commonplace. We're going to be discussing their benefits. Many of you know that indigenous peoples have worked with these various plant medicines for hundreds, if not thousands of years. And also, we'll be discussing some of the more serious concerns about the use of these plant medicines. I'm Ben Ufana, so let's dive into it. From an early age, I was drawn to Native Americans. By the time I was 14, as I began to hear the accounts of the traditional Native American doctors, the medicine men, the women, how they would go through experiences such as the vision quest, the Sundance, how they had these profound otherworldly visionary experiences. Many of them received these various gifts or healing powers, and that fascinated me. So at the age of 14, I was thinking to myself, if ever given the opportunity, this is what I will do with my life. I started saving money, and by the time I was 17, I was already on my own, living in a community of predominantly Kiowa Indians. And the fact that I resonated so much with the culture, I just went native. And one of my young friends said to the elderly man who had taken him in to raise, "Hey, Dad, Ben wants to go into the peyote meetings." The Kiowa normally didn't allow non-native people to come into the meetings, but for some reason, this elderly man, Jack, that I was ended up spending enormous amounts of time with, made an exception for me. Even when some of the other native elders pushed back, Jack would say to them, "This one is different. Let him come in." The peyote meetings were quite difficult for me initially because you go into the teepee about sunset, and if you're able to consume enough peyote, it'll keep you wide awake through the night and your body won't ache. The whole night that you're sitting there on cushions on the outer perimeter just inside the teepee, and you have no back support, you're sitting cross-legged, and so your butt would be hurting and your back and your legs, and not too comfortable. When I attempted to consume enough peyote to stay awake and minimize the discomfort, I would get quite nauseous and throw up. And it took me some time, but intuitively, I got a sense that I needed to start consuming the peyote like around early afternoon or maybe even 12 noon. And when I did so, my body could acclimate. And by the time we'd go in at sunset, I was ready. I was just in a much more open, receptive space. And it was a very productive experience for me. It was very powerful. I would gain all kinds of insights, enable me to gain perspective on my life. And sometimes during the peyote meetings, people would experience some kind of healing within their bodies, or maybe it would help them to address or resolve certain issues. And I remember one instance where I saw this vision very clearly as I was looking into the fire, which I will keep the specifics of that to myself, but it's something that I've called upon at times, and I found it to be very protective. It was actually in the peyote meetings that I first met my mentor, Horace Dokai, who was one of the last surviving traditional doctors among the Kiowa tribe. Horace was scheduled to conduct what's referred to as a doctoring meeting. That's where he was going to treat one of his patients. I was so afraid. Horace would say, "This is only for Native people. You can't come in here." Much to my relief that evening, before the meeting, I was talking with my young friend that I mentioned earlier, and Horace was across the hall talking with his father, and he just stopped and stared at me as if he knew something. And I think in that moment, he knew that I would apprentice with him at some point. During the meeting that night, he actually spoke to me. He was wanting to establish a connection. And it was about a year later when my grades were starting to go down in college that I actually approached him. And even at that point, I was really afraid, thinking that he wouldn't be receptive to the idea. But I asked him, or I said to him, I want to learn to do what you're doing. He asked me, well, what are you doing this weekend? Can you start fasting? And he had me drive down into the Wichita Mountains for the next few days, not eating or drinking. And that was his way of determining if I was truly serious. Before I move on to the next section, I do want to mention there was quite a profound presence or power in the peyote meetings. And I remember in one conversation with Jack, where he was telling me that there were times when the spirit, this presence, would come into the peyote meeting, and how you would hear the voice of a woman singing in Kiowa. And I remember one of the peyote meetings, which was actually conducted by my mentor, Horace, and I began to hear this voice of a woman singing so beautifully in Kiowa, and the words were enunciated so clearly. And in that meeting, there were only two women, and one of the two was Navajo. And obviously, she's not going to understand or know how to speak or sing in Kiowa. And the other woman, who was Kiowa, was quite elderly, and it wouldn't be in any way possible for her to sing like that. And it was at that moment that I remembered what Jack had said. And it's like, wow, it dawned on me there. And I had many special moments sitting up in the peyote meetings all those nights. Before we go any further, if you haven't already done so, be sure to look below and click like and subscribe. Once again, here I'm completing a lengthy, detailed article, which I would encourage you, if you're watching this video on YouTube, look below and read the more detailed article, or if you happen to be on my blog where the article is or the video is posted, look below and actually read the article itself, because there's so much more information than I could include in this video. Important information that you need to know to understand if you're going to be doing plant medicines. Because there is so much information packed into this article, important information that you need to know, I am going to be referring back to my article, reading some sections of it so I remember to include them. But anyway, ayahuasca, along with other psychoactive plant medicines, has been utilized for centuries by indigenous peoples for its spiritual, psychological, and physical benefits. In recent years, these substances have gained recognition from many in the mental health profession for their potential therapeutic applications. Ayahuasca and other psychoactive substances like psilocybin mushrooms are said to help with processing grief and loss, to reframe and integrate traumatic events, and to alleviate depression, anxiety, especially for those whom traditional treatments have not been all that effective. Many people report a reduction in feelings of isolation and a growing sense of connectedness to themselves, to other people, the earth, and the universe. Also, the temporary disillusion of this deeply entrenched sense of self, our identity construct, helps people to move beyond the stuckness of one's habitual patterns. And many people report gaining profound insights into their emotions, their actions, and relationships, and they feel more empathy and compassion towards themselves and other people. And it also helps them to tap into creative problem solving abilities, enabling them to discover workable solutions to the challenges in their personal and professional lives. While there are tremendous benefits to the use of these various psychoactive plant medicines, we also need to talk about the risks involved. Starting out here, the risks of trauma and distressing emotions surfacing with the use of these substances. Having trained with a traditional Native American doctor or medicine man and being in practice for a few decades now, I'm seeing on a daily basis that the vast majority of people have never learned to work effectively with their emotions. And so, whatever stresses, hurts, upsets, or angers them, whatever makes them fearful or anxious in life, all these things that people fail to process or digest remain trapped within their bodies. all those lived experiences and the highly charged emotions that arise in response to them. And traumatic events, even those going all the way back to the very beginning, even what occurred while we were still in the womb and anything afterwards. If we were neglected, if we were subjected to some kind of childhood verbal, emotional, physical, or sexual abuse, all these lived experiences and our subsequent emotional responses, again, whatever is not digested remains trapped in the body. Also, during the time that we attended school, if we were bullied or ostracized or made to feel rejected in some way, many of us still carry a lot of those memories and the hurtful emotions that we felt during those times. That also remains in the body. And as we grow into adulthood, a lot of the traumas that occur as a result of sexual assault, for those who had served in wars, such as in Iraq or Afghanistan, a lot of that combat related trauma, for instance, would be stored in the body. Most of us have had our heart broken at some point, often numerous times. And so, whether we've gone through a devastating breakup or divorce, or someone has ghosted us that we had formed a detachment to, someone that we really liked, or someone was stringing us along emotionally, all that hurt and sadness and grief and those painful memories is stored in the body. It's important for us to understand that unless we learn the practices and make use of the therapeutic interventions that help us to thoroughly digest these lived experiences and our subsequent emotional responses, all those impressions of those lived experiences and the emotions that we haven't processed, they will remain trapped in our bodies, and many of us will carry it to the grave with us. We all form defensive structures, and they do serve a very important purpose, especially you consider those of us who experience various childhood traumas or even later life traumas. If we lack the ability to process or digest these lived experiences and our subsequent emotional responses, we have this natural protective mechanism that works to contain these experiences and all the highly charged emotions associated with them. But what happens as we use these powerful psychoactive substances, our defense mechanisms temporarily dissolve. And in some cases, the defenses that have built up over the course of our lives are not able to reestablish themselves. And when our defenses come down, what often happens is we find ourselves flooded with the emotions and the impressions associated with these painful or even traumatic events that have occurred at various points in our lives. And that can leave us feeling not only overwhelmed, but struggling to cope. And some of us will manage to work through these distressing emotions and regain our footing, while others will not. When people are not able to work through the flood of traumatic memories and emotions that surface during these experiences with ayahuasca and other psychoactive substances, they can face serious psychological and emotional challenges. And without the proper support, and integration following these experiences, they may find themselves feeling even more vulnerable and destabilized than before. The sudden release of all these deeply buried memories and emotions can overwhelm their ability to cope, leading to intense anxiety, panic attacks, or depression. For some, this overwhelming experience can exacerbate underlying mental health issues or trigger new symptoms such as paranoia, dissociation, or even psychotic episodes, especially for individuals who have a predisposition to conditions like schizophrenia, bipolar disorder, or other psychiatric disorders. These intense and uncontrolled emotional responses can create a state of emotional and mental disarray, making it difficult for an individual to distinguish between past traumas and their current reality. And this can result in a prolonged state of distress where they struggle to return to their normal functioning and may experience ongoing confusion, fear, and emotional instability. Right around the time that I graduated from college, a good friend of mine and his girlfriend had broken up. And while still in that emotionally vulnerable space after the breakup, my friend decides to take psilocybin mushrooms, which had an incredibly disorienting and destabilizing effect on him. And while he was tripping, he found himself overwhelmed by all these painful emotions that he hadn't been dealing with. At that time, I was just beginning my practice, so I didn't yet have the knowledge or experience, but I offered to work with my friend to see if it would help him in any way. And the session did help him to process all that grief and other intense emotions. It helped to reestablish his equilibrium and his ability to function. And he was definitely feeling much better afterwards. And since that time, I've worked with many individuals who have experienced similar difficulties after using plant medicines and other psychoactive substances, including heroin, other opioids, crystal meth, other recreational drugs, ketamine, MDMA. A number of these individuals have suffered serious cognitive and emotional impairments, which have impeded their ability to function in their daily lives. And it saddens me to witness the damage that has, in many instances, been caused by their use of these substances, including damage to the brain itself. Again, I've trained for years with a traditional Native American doctor and medicine man, and have furthered my abilities by going through quite a few vision quests. And as a result, I'm able to work as a conduit, allowing an extraordinarily powerful presence to work through me. And in many instances, these individual sessions have facilitated the healing and restoration of the critical faculties, individuals' ability to function. However, there are also times where the extent of the damage is so severe that it cannot be fully repaired, and essential functions cannot be restored. And this is why I strongly encourage people to exercise caution when using these plant medicines and other psychoactive substances. This is also one of the reasons why I so strongly emphasize foundation building, which involves teaching the people I work with practices that enable them to digest both their lived experiences and their subsequent emotional responses. And by learning to work effectively with your emotions, it facilitates the healing of the deep emotional wounds, but you also develop greater resilience and self love. You learn to truly care for yourself, and you develop what I refer to as a common sense that prevents you from taking harmful actions that end up resulting in serious harm to yourself. As I was saying before, psychoactive substances such as ayahuasca can have profound effects on people, especially those with mental health issues. Again, bipolar, people with autism spectrum disorders or psychotic disorders. And many people seek out these substances in hopes of achieving healing or spiritual insights, but it's important to recognize the risks involved, particularly for those with pre existing mental health vulnerabilities. These psychoactive substances, like ayahuasca, can, in some instances, trigger or worsen psychotic episodes, possibly causing hallucinations and delusions. Another consideration for those with the aforementioned mental health challenges is there is often a fragile equilibrium that keeps these individuals, anyone who's struggling with these challenges, that keeps them functioning on a day to day basis. They're walking a fine line, maintaining that delicate balance that in some instances they're barely holding on to. And when you introduce powerful psychoactive substances into the mix, that can easily disrupt this fragile stability, causing a person to, it's a clinical term here, decompensate. That means losing it. And for these individuals, their already precarious state can unravel further, exacerbating any psychotic tendencies they may already have. They may emerge on the other side more disoriented, with both their body and mind struggling to regain the fragile semblance of balance they once had. After using these substances, they may find themselves unable to function as well, feeling disoriented with their bioelectrical system scrambled, and their brain and body's operating systems struggling to process their life experiences, their emotions, and their thoughts. And many of these individuals are already struggling to cope with everyday life and the emotional challenges related to it. And this could be in areas like dating, relating to people, working with colleagues, cultivating and maintaining friendships, or with the introduction of psychoactive substances that can often exacerbate these existing issues, making them considerably worse. And I've witnessed many individuals over the years experiencing these various psychiatric issues after using acid and mushrooms and other psychoactive substances. And some of them end up on psychotropic medications to control their symptoms. But these medications have serious drawbacks. Medications like Klonopin and Haldol or whatever they're prescribed, and that can often leave them feeling zombified, dulling their capacity to process and digest their lived experiences and their emotional responses. And this, again, is why I feel it's so crucial for anyone struggling with mental health issues to seriously consider the potential consequences of using these powerful psychoactive substances. In some instances, we can restore their mental and emotional stability, but I would much prefer people just not take these unnecessary risks. Again, I've spent years training with a traditional Native American doctor and have gone through numerous vision quests. And having done so, I'm able to serve as a conduit, allowing a very powerful presence to work through me to facilitate healing within the bodies and minds of others. And the changes that occur in these sessions are profound, often restoring an individual's ability to process their experiences and their emotional responses while building a stronger foundation for a healthier relationship with themselves, other people, and the world around them. And it's challenging to fully convey all of this in word. Basically, one needs to experience this kind of thing firsthand, working with myself or working with other healers from these various indigenous traditions in order to fully comprehend what I'm talking about. But those who have the opportunity to experience this work often find a renewed sense of stability and a greater ability to be fully engaged in their lives. In the next section of this article, I'm talking about the potential harm of some of these psychoactive substances. Yeah, there's a lot of detail. I suggest that if you want to know more, just go ahead and read the article. But I'll just say briefly that the use of these substances can, for some individuals, can result in severe psychological distress, including fear and paranoia and overwhelming anxiety, especially for individuals with a predisposition to mental health disorders. And then there are also physical effects such as the increased heart rate and blood pressure, and that could pose a risk for those dealing with cardiovascular issues. There's a superficiality in our culture in this modern world that we're living in. So, for instance, you go to an ayahuasca or some other plant medicine ceremony, and you have these supposedly profound realizations, and maybe it does give you some new perspective on your life. But all you've done is take some powerful psychoactive substance. You haven't truly worked for it. And then you return to your mundane life and you get caught up in all the day to day, and these insights begin to fade. While your perspective may be slightly broader, you haven't necessarily grown or evolved. On the other hand, in a number of these ancient traditions around the world, it's fairly common for individuals to do hours of intensive daily practice. And throughout history, there have been many who have committed to such a discipline and have attained varying degrees of mastery, and with some even possessing extraordinary powers and paranormal abilities. Now, plant medicines can be a helpful aid, and yet it's not wise to become dependent upon them. If you do, you're not likely to get very far. And this is why I encourage everyone I work with. You need to be doing some form of intensive daily practice to develop both your body and your mind and to deepen your connection with the core of your being and the higher power. And this could involve practices such as Qigong, pranayama, the meditation practices that I teach. Equally important is utilizing the most effective therapeutic interventions, such as deep tissue body work, sessions with gifted healers, or even going on the vision quest as I do. There's a commercialism that has become very much a part of spirituality in our modern day world. And understandably, everyone, unless they're independently wealthy and they're freely offering a service to others, needs to be compensated for their work and travel expenses and accommodations. But I have often felt taken aback by the exorbitant amounts of money that people are paying for ayahuasca and other plant medicine ceremonies. Namely, people paying hundreds and even thousands of dollars to attend these ceremonies. And when you consider the fact that it could be a handful of people or maybe as many as 40 or more people attending an ayahuasca ceremony and paying hundreds of dollars a piece or more, thousands in some instances, somebody is raking in a serious amount of dough. I want to contrast that with my own experience. If I needed the help of a traditional Native American doctor or some other indigenous healer, I would compensate that individual generously because they're devoting a lot of time and energy to me, and I am receiving a healing of much greater significance. However, when it comes to plant medicine ceremonies, all those peyote meetings I attended, well, I did help, with gathering wood or setting up the teepee and other things that needed to be done. Maybe I brought some food to contribute, but I never once paid to attend any of the peyote meetings. I also want to talk about the importance of maintaining protective boundaries in the context of these ceremonial experiences. When I was in my late teens and early 20s and attending the peyote meetings, at that time I was not all that present in my body. I was fairly dissociated. I still carried a lot of trauma from my childhood and adolescence. And so I was pretty numbed out in those days. But even then, I could still feel. There were times where somebody could show up in one of the peyote meetings and that person was drinking heavily on a bender for some days beforehand and sobered up just in time to come into the meeting. But over the years, as I've done so much intensive practice, all these hours of meditation practice that I've done, doing Qigong and all the therapeutic interventions, the body work, the sessions I've done with gifted healers, going through the vision quest so many times. My body has gone through its own not only healing but cleansing process. And as that happens, as your body cleanses, you develop a much greater sensitivity. And so I feel deeply what other people are carrying. I feel their emotional wounding. I feel the emotions they're carrying in their bodies. I can feel the issues they're struggling with. Times, somebody is physically ill, if they're on various medications, I feel all these things. And so, because of that, I've become much more protective of my own boundaries. It's important to consider, for instance, if you're going into an ayahuasca or some other plant medicine ceremony, a lot of times they have people packed into a limited or confined amount of space And so you can be in one of these ceremonies and you're sitting there with people who struggle with addictions to alcohol and other recreational drugs. There could be people dealing with a range of mental health issues, or they've lived through all kinds of traumatic events, and they're not necessarily dealing with that, and they're holding that trauma in their bodies. A lot of people are on all these medications as well, psychotropic medications to control the symptoms or to push down or numb themselves to the emotions they don't know how to cope with. You could have people who have done or continue to do some really horrible things where they're hurting or abusing other people. And when you are under the influence of alcohol, or even if you're smoking weed, if you're using these psychoactive substances such as ayahuasca or any of the plant medicines, your natural protective boundaries come down, they dissolve to some extent. That makes you more vulnerable. There's a greater likelihood of you absorbing the emotions, the toxicity, the sickness, the dysfunction, the karma, or whatever garbage that some of these individuals are carrying. So for me, if I were to use any of these substances, I would insist it is non-negotiable. I need a buffer of protective space around me. Because I do so much intensive practice, I would say I need probably at least a good 10 feet or more of a buffer of space around me. I'm just not going to sit in such close proximity with people. Again, the fact that I've done so much intensive training and practice, gone through so much cleansing, purging over the years, I'm not going to sit in such close proximity to people who are carrying so much garbage. As I continue to do more and more practice and my sensitivity increased, I was talking one day with Shifu Li Tailiang, the Chinese master that I have trained with for quite a few years, about what was happening, how I was feeling a lot of the garbage, the toxicity people were carrying in their bodies. And he said, yeah, that's part of what happens as your body and mind is developing and you're developing this greater sensitivity. This is a protective function because we are all vulnerable to some extent, and we need to be very selective about who we allow into our immediate space. I want to also address the limitations of the use of plant medicines. I keep myself open to the best of my ability. One of my favorite quotes came from Albert Einstein. He says something to the effect, the more I learn, the more I realize I have yet to learn. It may not be verbatim, but it's something to that effect. And so I'm always keeping myself open. I always want to learn more. But over the years, when people would tell me that they're doing these various practices or therapeutic interventions, I always have this curiosity like, I want to see how it's helping them, how it's enabling them to grow and evolve. And I also need to understand the limitations of these various practices and interventions. So once somebody tells me what they're up to, and I'll say, hey, can I check this out? And if they're open to it, what I'll do is I'll have them stand in front of me and I scan their body and mind. I have them stand there and I close my eyes and I hold my hand in front of the body and I could feel through my hand all kinds of things, their emotional wounding, whatever traumas they're carrying or the issues they're struggling with. I could feel the resources they possess. Also, if there are certain deficits that impede their ability to function, if there's physical illness or some disease process that's occurring, I could pick up on all this. And when someone's doing these various practices and therapeutic interventions, I could see, I could feel how it's helping them. I could also feel like, well, sometimes maybe it does some things, but it only goes so far. In other words, there's a lot of things it may not be doing that need to be done. Over the years, there have been quite a few people that have showed up in my classes or that have come in to work with me individually who have done ayahuasca and other plant medicine ceremonies. And some of the things I've noticed, I've had individuals who were hugely dissociated. I mean, they just were not all that present in their bodies. They'd never really rooted into their bodies. When I look in what's referred to as the chakras, the layers of the aura, oftentimes they're very much stunted, they're underdeveloped, and they can be kind of ethereal, and they lack many of the resources they need in order to be fully functional, to fully inhabit their bodies, and to be truly effective in their lives. And some of these individuals, despite the fact that they had attended sometimes numerous ayahuasca and other plant medicine ceremonies, when I'm looking into their subtle bodies, I could still see that they were very much dissociated. Their use of the plant medicines hadn't really made a significant impact in terms of enabling them to become more embodied, more present, more functional. Also, a number of the people that it showed up to work with me individually, when I look in their subtle bodies, say if they had experienced a great deal of trauma from some form of childhood abuse or other traumatic events that had occurred in their lives. There's so many instances where, as I look into their subtle bodies, I can still see and feel the traumatic wounding. Those traumas are still very much present within their bodies. The use of the ayahuasca and the other plant medicines, it had not facilitated the processing, the healing of those lived experiences and the subsequent traumatic wounding. Again, there are limitations. Although maybe on some level it's helping them, they're gaining some insight, they're understanding. And yet it's, as I said, it's not fully enabling them to do the deep level processing and fully heal the dissociation, to become fully embodied, are enabling them to heal the traumatic wounds that are having such an adverse effect upon them. Years ago, even when I was attending the peyote meetings with these native elders, even at that time, it was quite apparent to me that these elderly men and some women that I was sitting up with all night during the peyote meetings, they didn't possess the extraordinary powers that medicine, that their forebears generations back possessed, who were going through the sun dance, going through the vision quest. And for me, that was part of the reason that I was seeking more. I knew that there had to be more. And it's part of the reason I reached out to my mentor, Horace, and began my training with Horace, who again was one of the last surviving traditional doctors among the Kiowa tribe. During my apprenticeship with Horace, at times he would transmit portions of his own healing gifts, that power, that medicine. He would transmit that to me. But then, in order to earn the right to work with these gifts of healing, he would have me go on the vision quest, which entailed typically the vision quest, you're out 4 days and nights, no food, no water, fasting alone in the mountains. Since that time, I have gone in the spring and fall for decades now. But the fact that I had suffered so much trauma during my childhood and adolescence, for that reason, I know firsthand the critical importance of doing what it takes to heal these deep emotional wounds and to become fully rooted within our bodies. Like as I've gone through the vision quest all these times, as I mentioned earlier, there would be instances, especially like during the fourth night, where I would have portions of my life flashing rapidly before my eyes. And I could feel during these times these extraordinarily powerful beings descending into my body, enabling me to transform and then digest the actual traumatic events, all the highly charged emotions attached to them. Subsequently, they were going about building this foundation that had never developed before. So I'd come out the other side, I'd be more embodied, I'd have access to more resources, I'd be more capable. I'd have this expanded range of motion. And for me, this has been an ongoing, decades long process. It's also during the vision quest that I have received what Native people have commonly referred to as medicine, are the gifts of healing that have enabled me to be of assistance to other people. In fact, many of the people who have the opportunity to work with me experience a healing within their own bodies and minds that is in many ways similar to what I go through during the vision quest. In May of this year, a woman that I was working with wanted me to scan her body to see what I might notice. And although I'm usually quite perceptive, I wasn't noting anything of great significance, which I told her. But she then shared with me that the night before, she had done MDMA, a powerful synthetic psychoactive substance, also known as ecstasy or Molly, which is known for its ability to increase feelings of empathy and closeness and emotional connection. Now, I don't remember all the specifics, but the woman I was working with mentioned that she felt she had had this profound breakthrough, and along with all these realizations. However, as I mentioned, I couldn't see any meaningful change or transformation occurring in her body. And it's important to understand that these psychoactive substances elicit these intense biochemical reactions within the brain. And problem is, it doesn't go that much further. It doesn't really translate into the body. And their effects in many instances are only momentary. And it's really not that different from the folks who were dropping acid a couple of decades ago. And yes, they had some seemingly profound realizations, but it didn't really get them anywhere. And taking acid can result in serious cognitive impairments, and some have suffered major psychiatric issues as a result. And while this article primarily focuses on plant medicines like ayahuasca, psilocybin, and peyote, it's important to also address the synthetic psychoactive drugs that have grown in popularity in recent years. And these substances, although not derived from plants, have a significant effect on the body and mind and are increasingly used both therapeutically and recreationally. Ketamine has been increasingly used to address treatment resistant depression, anxiety, and PTSD due to its rapid acting antidepressant effects and ability to alleviate depressive symptoms, often within hours. MDMA, on the other hand, has demonstrated significant potential in psychotherapy for PTSD, helping patients to process traumatic memories by reducing fear and enhancing feelings of emotional safety and connection. Now, in addition to the therapeutic use of these substances, many people are using them without understanding the potential risks involved. And while both drugs have been shown to help with mental health conditions like depression and PTSD in controlled clinical settings, using them recreationally can pose significant dangers. These include psychological distress, cognitive impairment, addiction, and severe physical health issues. Ketamine is referred to as a dissociative anesthetic, and it can cause dissociative experiences, including feelings of detachment from the body or reality. These effects can be disturbing, leading to intense hallucinations, confusion, or paranoia. Prolonged or heavy use of ketamine can impair memory, concentration, and overall cognitive function, with frequent use increasing the risk of long term cognitive deficits. And some users may experience anxiety, agitation, or depression following ketamine use. And there's also the potential to worsen symptoms of pre existing mental health conditions. Physiologically, ketamine can elevate the heart rate and blood pressure, which can be dangerous for individuals with cardiovascular issues or those prone to hypertension. MDMA has shown therapeutic value, particularly in treating post traumatic stress disorder. And it can help individuals to process traumatic memories. And yet, this drug can also cause anxiety, and paranoia, and intense emotional fluctuations due to its impact on serotonin levels within the brain. With frequent or high dose use, MDMA may lead to neurotoxicity, potentially resulting in lasting damage to serotonin producing neurons. And this can impair cognitive functions such as memory and decision making and exacerbate mood disorders like depression and anxiety. In some cases, users may experience heightened anxiety, paranoia, and in rare instances, psychosis. Some of us, despite growing up in this modern day world, have a natural or intuitive sense or understanding of these various plant medicines, similar to that of indigenous peoples. However, so many people living here in our modern day world lack the cultural context and often feel empty, emotionally numb, disconnected from their authentic core self, and are devoid of any real spiritual connection. Many are carrying the scars of past traumas and are struggling to navigate their present day lives and are unsure of how to work effectively with their own emotional responses. Understandably, so many of us, we're searching and we're uncertain exactly of what we're looking for. And yet we long for growth and a way to heal the wounded parts of ourselves and to live a more meaningful life. And there are also those who just use plant medicines like any other recreational drug. Conversely, you have indigenous peoples who have long understood the sacredness of the various plant medicines and have had a context for working with them that dates back hundreds, if not thousands of years. And these practices have been an integral part of their cultures. And the traditional doctors possessed a deep understanding of these medicines. And these healers knew how to listen and to interact with the spirit of these plants, something that most people in our modern day world either don't know how to do, and many just do not have the capacity to do so. And these traditional doctors, they also understood when someone might be at risk because of either physiological or mental health issues and would only encourage the use of these plant medicines when they were confident that the individual could safely and effectively benefit from them. There's so much to say here, and there's a limit to what I can include in this video, but in parting, what I want to say is that plant medicines undeniably have therapeutic value, as evidenced by their use for thousands of years among indigenous peoples who have relied upon their healing properties. These substances can also facilitate profound emotional and psychological healing when used with respect and understanding. However, it is essential to approach their use with caution. Without the proper guidance, support, and environment, the powerful experiences they can evoke may lead to unexpected challenges or harm. It's crucial to honor the potential benefits and risks, ensuring that these sacred medicines are used responsibly and thoughtfully. Thank you again for joining me for this presentation. Be sure to look below to click like and subscribe. I do work with people individually, so feel free to reach out to me if I can be of assistance. And if you haven't already done so, click on the link below this video if you happen to be watching it on YouTube to read the more detailed article, or if you're seeing the article on my blog, just look below the video and read the detailed article for a lot more in-depth insight into the use of plant medicines.